Welcome to the Accidental Experts podcast. I'm your host, Bryce Hamilton. I'm a licensed clinical social worker and a child and family therapist. I have been in practice for over 15 years, and I'm also a mom of 4. So I know the challenges both professionally and personally. I'm so glad that you're here today to grow your parenting toolbox. Please come as you are and be ready to learn. My goal is to make you the accidental expert so that you can raise healthy humans. Hi, everyone. Welcome back. I'm so glad you're with us today. So we are going to talk to a special guest. Her name's Miriam Mandel. She is a physician, a pediatrician, but she's also a coach for teens and parents. And one of the things that she specializes in is helping navigate vaping. So she's going to talk to us today about vaping, what we need to know, and the dangers and how to support our kids. With that, let's get to Dr. Mandel.
Oh, thanks. Thanks. Yeah, it's great to be here.
Yeah, so we're going to be talking about teens and vaping and kind of what this looks like, because this is really an epidemic.
Mm-hmm. Yeah, it's real big in the high schools, middle schools, and actually I've had some elementary school clients. I don't know if you have you had any elementary school clients that?
So I haven't, so here where I live, we sometimes have a 6th grade in elementary school, and I did have a 6th grader who was part of an elementary school, but I haven't had younger than that before. But it's
Okay.
scary to
Yeah,
have this young of kids attracted to vaping.
yeah, and um, I find that I think it's the biggest problem is in high school where there's the most activity, and it's just kind of it's almost like just a norm, and especially on college campuses as well. Like I have once my son is in high school, my daughter's in college, and she's in Chicago, and she said a lot. Actually, she said more people smoke on campus, like they smoke cigarettes, but vaping
Fascinating.
is very popular.
Yeah.
People keep it with them everywhere.
Yeah. So let's start with kind of talking about like what is vaping, because I think some parents, we don't even really understand what vaping is and how it works and what's in it. Can you tell
Yeah,
us about
yeah,
that
sure.
piece? Yeah.
It's basically just a device that has some basic, and now remember they're changing all the time, right? These devices are changing all the time, but basically there's a mouthpiece, there's a tank, there's a heating system. So what's going on? And there's like you could you could actually put some liquid in it, or you could put cartridges in it. They're either disposable or they're reusable. So there's many different types. There's the mods, which are where you could actually change the different features on it. And then there's the regular disposable, the electronic ones that actually look like a cigarette, which is like the first generation. Don't see many of those anymore. Then there's the Juul, where there's like that thin, flat. I don't know if anybody has seen a Juul. It's like a thin, flat. They look like USB drives when they get rid of them. But it's basically just a device where you have a heating element and some liquid, and there's about 99% in the United States have nicotine in it, with a bunch of other chemicals in that to help dissolve and get those elements into the lungs, right? So that's where the heating element comes in.
Yeah. So it's kind of like a cigarette, but an electronic version of that.
Yeah, except that it doesn't have tobacco, and it doesn't have the tar, which cigarettes have. And I think that's probably why people think that it's so much healthier than cigarettes. There's that misconception of that vaping is benign. It doesn't really cause any problems. I think that's probably where it first started, is that it doesn't have tobacco. It does have nicotine, which is in general it's not a carcinogenic. It doesn't, I mean, nicotine is not necessarily it's not the bad part of the vaping. It's the addictive part of the vaping that keeps the kids coming back, but it's not the dangerous part of it.
What is the part that you would say is like the dangerous part of the
in
vaping?
these pods or in this liquid, that you need a solvent to get those things to a heating point to get into the lungs. So there's different solvents in there. There's different toxins. There's different carcinogens in there that have you ever heard of popcorn lung?
Yes.
So
Yes.
there's
I've seen it.
diacetyl.
Yes.
Yeah.
Yes.
So diacetyl, which is actually popcorn lung, is something that is used in flavoring. Supposedly it's safe to take by mouth, but when you heat it, it can cause all sorts of problems in your lungs. So there's something called bronchiolitis obliterans, which is in medical literature. Doctors know about it, but that's popcorn lung. So they found out why that was happening with this vitamin, the vitamin E. There was some association with that, and they were able to take that out. But there are different chemicals in those pods that, when heated, become toxic and become carcinogenic. So there's, when it's not heated, they're not as dangerous, but when they're heated, that's where the problem comes in.
Yeah, that makes sense. Yeah, because they're probably not really researched in the heated form, because if somebody is taking something.
Yeah, because you know what it is? It's the flavorings. And there's so many. I think there's like over 7,000 different flavors or something crazy. Yeah, like crazy amount of flavors. So what they're doing is they're testing it with AI, and they're finding that there's at least some, in all those flavorings, there's some toxicity in pretty much all of them.
Yeah. Wow.
Yeah. So because there's so many, they can't, and there's so many chemicals in there. So, and there's so many different flavors, so they can't do it all. It would take too many years to do that. So they're doing it with AI.
Yeah.
That's how but still it's a slow process. So there's so many unknowns that we just don't know yet with some of the, with various different flavors and products.
Yeah. So when we say, like, I'm thinking about this, like, lots of kids will use different vernacular around this vaping part. So they'll say, like, and I want to just like clarify. So like, our e-cigarettes and vape pens and carts, like, there's a lot of different words that they use. Is all of that in relation to this, or are there some of those things different?
It's all in relation. The carts are actually the cartridges.
Okay.
So there's vape juice, they call it. I mean, there's so many different terminologies, like vape juice. They're cartridges or they're refillables. People are vaping marijuana now too. You can vape marijuana in different forms. But for the purpose of this discussion, we'll kind of just stick to nicotine. That marijuana is a whole different animal with teenage brain.
Yeah.
And a lot of these things, like, I feel like with vaping, I really, so actually, before I go over there, to answer your question, yes, in e-pan, vape pen, vapes, mods, they're all different words to describe a vape. The cart is actually a cartridge. It's called they use that as cartridge. So the little refillables,
Yes. Yeah, it's even in other words. Like, I love how when my clients come in and they like say something and I'm like, what does that mean? And then they tell me and I'm like, why did we need to shorten that word? Like, that's so sus. I'm like,
why do we need what?
to shorten the words? Like it's like they have slang for everything. So it's like, yeah, as a parent trying to like absorb all the things, right? And to like know all the words that we need to know. Sometimes it's really hard. So when we think about vaping, right, what is the actual problem with teens or anybody vaping, right? Like, what is the drawback with doing that? What's the danger?
Well, there's the physiological dangers of, so if you think about, and then there's also the mental dangers, really, of the addiction. And that's not fun to have to deal with. And that's, I actually got a lot of calls from moms that were having kids in withdrawal during COVID because they weren't getting to school and they weren't getting their supply. And these kids the parents didn't know what was going on, right? Because they've never had a physical addiction before. And then they're getting irritable and they're getting nauseous and they're getting, they're just not feeling well, and explosive behavior, because if anyone has been addicted to a substance, coming off of it is very difficult, right? And it's also they're used to getting this every time they take a dopamine, every time they take a hit, they're getting a dopamine surge. So they're actually training their brains, which is for me, a very scary part, is they're training their brains to get a dopamine hit without doing anything to deserve it or to justify it. Like when you go to the gym and you work out and you're feeling really good, or you go for a run, like you're getting that you're getting that, but you're doing something for it. You're working for it. That's how the human species was evolved. That's how we were supposed to be using dopamine, because it keeps us driven. It's not so much just reward, because once you get the reward, the dopamine isn't there really anymore. It's the pursuit of getting the reward. So these kids they're not having to pursue anything. They're just sitting there and they're taking a hit, and it's constant throughout the day. So the half-life, I think the half-life of nicotine is about 1 to 2 hours, but they need to take a hit because their dopamine level will come down within 30 to 45 minutes. So that's why every time they're taking a hit, they're reinforcing that, because their dopamine comes down. That causes like a pain. It causes a craving. It causes a discomfort. So it's almost like they have to take a hit. And that's why it's so difficult. Like I had a kid, a football player, believe it or not, a lot of athletes vape. In my experience, that's what I've seen. A lot of athletes
I've seen it too. Yeah.
And he said he was just so sick of being a slave to this device, where he would notice and see that his friends couldn't even sit through class without taking a hit, right? So
they're sneaking it like in their sleeves or whatever.
Yeah.
I mean, they have it. Yeah.
Yeah, they have it. I mean, so one thing that's, probably, kids have to keep up on this, right? Because these things are coming out new all the time. So what's really important, I think, is for parents to understand, and we can talk about this a little later, but to understand that this is not something that you go and you just see like a cigarette. You're not going to recognize, generally, if you go into your kid's room, you're not going to recognize what it is, because there's a whole industry trying to disguise it rapidly. So parents don't find out, and that this is like the kid's thing, and then they can sneak it a lot more easily, which, for a kid is great if they're, doing it and you're getting away with it. They think that it's great, but in the long term, it's really just going to hurt them.
Yeah. So we have the dangers are the nicotine's addictive, right? Yes. And then you get this craving. And so then you need to get the dopamine. So what other side effects, like of all these chemicals, are there? You said they're carcinogens, which means cancer causing. Is that right?
Yeah. But the main thing, like the most maybe physiologically, it does affect every epithelial cell in your body. And an epithelial cell is anything that lines a blood vessel, an organ, and I mean, so pretty much everywhere in your body. So when you're taking that inhalation, it is going to affect every cell that's an endothelial cell, which is extremely common, right? So we know now that vaping does cause stroke. We know that it causes heart disease. We know that it causes lung disease. We know that it's very bad for somebody with asthma, allergies. I have kids that are completely healthy and they get scared because they become short of breath. And then they want to quit, and then the cycle, they're too far in and they can't do it on their own. So they get scared. And that's a lot of times when they get referred to me, either as a coach or a physician. And a lot of times kids I feel because this is my population, is that they will feel more comfortable speaking to a doctor about a physiological effect versus the addictive part and the psychological part. That comes later, right? After you kind of build a little bit of a relationship with them, but they're interested, or their heart is racing, right? Nicotine is a stimulant. So what's kind of cool about nicotine, like nicotine is not a bad drug for adults. For kids, it's bad, but for adults, what's kind of cool about nicotine is that it's a stimulant. It can make you think more clearly and have more focus and concentration. The kids too. That's why they like it.
Yeah.
But it's also a muscle relaxant. So it's a really cool combination if you think of it. So it's not that, I don't think nicotine is a bad drug. I think it could be used, but not in kids. Anybody over 25 that wants to use nicotine in a safer way, like a patch, people use like educators, scientists, it's not a bad thing to use nicotine, but they're using it in a much safer way. The delivery system is where nicotine gets dangerous. It's not the nicotine itself, it's the delivery system. And anything that you're inhaling into your lungs, if you think about it, sometimes I'll just have like a talk with these kids, like, listen, you have all this solvent with known toxins in it. in tiny, tiny little particles that you're inhaling deep into your lungs. How could you think that's safe? It's just common sense. Like, you don't need research. You don't need all this stuff. Like, just use your common sense. How could that be safe? How could taking a cigarette and inhaling a cigarette with thousands and thousands of toxins inhaling into you? We didn't need the research from the government, right? I remember thinking this as a little kid, like, it doesn't make any sense. How could that be safe? And I did smoke when I got older. So it's not like I was like, above all that. I did smoke, and I loved smoking cigarettes, but I found I started exercising, and that was the end. And I knew I started to run, and I knew that I would never smoke again, because I wanted to run and exercise for the rest of my life, because it was such a better feeling, that those endorphins and the dopamine was just so much better in that respect than through a cigarette,
Yeah. Yeah.
I was already addicted. So it took me a long time. Like, I mean, once I got to that point, I quit, but it took, and just like like kids should know that they're not gonna, the chances of them just saying, okay, I'm done vaping, and then doing it is very low. Like, you have to practice quitting in a way, because you learn what works, you learn what doesn't. You're like, and then you find yourself even at a habit doing it again, So I guess if there was one thing I would want to say to kids, is not to be too hard on themselves for trying and failing. Eventually they'll get it. If they really want to quit, there's help out there. There's ways to do it where you don't have to do it cold turkey, that make it a little bit, take that edge off a little bit, so you can get through the day a little more comfortably. But there's actually a lot of different things that we can do to help them. So it's a process, but it's definitely doable. Sucks, but doable.
Yeah. Well, it's nice to know that there's support, because like, I think when I've talked to people that have had addiction, it's like their entire body hurts.
Yes.
Everything hurts. It's painful to, even if it's just that uncomfortable feeling, it is painful, and people can report, excuse me, just the stomach pain or feeling nauseated, and, headaches and irritated, and like, all of that is painful to be in your life. Like, you just want to feel fine. And so then you're more likely to go back to that, because it immediately like resolves all that.
That's a great point, because these kids are only, or adults too, like addiction, like they're only vaping to feed that craving. That's why. It's not because they're getting such massive, of course, at the beginning you are getting some benefits, right? I mean, for a teenager, like, it helps you focus, it helps you concentrate, it relaxes you, you're in a way. It can help you lose weight, it makes you socially acceptable, you fit in. I mean, why wouldn't these get, it's directly advertised towards middle school as the biggest advertising market. Do you know that, I don't know if you know, I just found this out, that Juul, when they came out, I think they came out in 2015, they were actually advertising, this like blew my mind. They were advertising on Nickelodeon.
What?
Cartoon Network.
No.
Advertising on, it gets worse. So Nickelodeon, the Cartoon Network, they were advertising on like math.com. Yeah, they were so they had to take all that away, but that's what they were doing. Can you imagine the Cartoon Network? And so the marketing is so directed, obviously, towards kids. Although I personally believe it, and maybe I'm just naive, but I don't believe that the e-cigarette was developed to hurt kids or to hurt anyone. I really feel like when it was originally developed, it was developed to help adults quit smoking. And for some adults, it absolutely works. Absolutely. But the spillover is our kids, right? Because the marketing got so out of control. It got so out of control. And the amount of money that these companies are making are astronomical, and they don't care. Just like, I mean, we're in a capitalism. This is capitalism, right? Like, I don't understand how they can sleep at night, but they do. But they are basically using everything they have. The psychologists, they're using AI, they're using everything they can to addict our kids so they could have a client that's lifelong, right? Just
like for life. Yes. Yeah.
Yes. For life. And I personally believe these kids are too smart for that. I really do. I think eventually these kids are just too smart for that. They're going to know they're being manipulated. They need to be told they're being manipulated because they are. They are. And research actually has shown that that's the best way to get kids, right? So there's this boardroom of all these, I mean, not to sound like prejudice, but it's like all these white men, these middle-aged white men are sitting around a table deciding how to get kids the most addictive to this substance and to make the most amount of money, you know?
Yeah. I mean, that infuriates me. I know I'm somebody who's like, I want freedom. I want to be in control of my life. So thinking about that part of like somebody is trying to take that away from me makes me mad, even as a 40-year-old woman. Right. So like, I think, you know, as a teenager, like the last thing they want is the man, right, controlling them.
Exactly. And that's why I use that. I probably shouldn't have said that, but that's what I use, because when you read the literature, it's all about the white men in the boardroom sitting around trying to manipulate and get as much money as they can out of this generation. Sure. And it's disgusting. Like, I just think it's disgusting and it's sad. And unfortunately, it's so appealing. They've made it so appealing, and it is so appealing, and it is so addictive. I mean, there was a time when nicotine was free-based and you could only inhale a certain amount because it would burn your throat. So the concentrations were lower. And then they started adding these nicotine salts, and it's much smoother. So I believe it was Juul that was one of the first to utilize that. I'm not positive, but I think it was, where the concentrations were able to go up a lot higher, which for somebody who's trying to quit smoking could be helpful. But in general, it's just going to be more addictive to the kids that they're actually advertising on Nickelodeon and the Cartoon Network for.
Yeah.
Right?
Yeah, absolutely.
Crazy.
Oh my gosh, that's wild. Truly. I did not know that. Like, but yeah,
I just learned that. Because Juul is actually back in the news now. They're reversing the ban. There was a ban on Juul because there were so many lawsuits, and they weren't giving the government enough information to make sure that it was following regulations. So it's been kind of banned, but it's been able to be sold in the stores during that ban. Even now, it's still able to be. It's still the second leading brand that's, you know, popular with kids. But they did lose a ton of money during those lawsuits, and they did a lot of settling. You know.
Yeah.
So
yeah, because what they were doing was wrong. Yeah.
They knew they were right, and so they like tons of money on individual and lots of civil lawsuits that they had to pay out, and now they're trying to get it regulated again. But they say that it's not. They did reverse the ban, but it's not that. But they're still investigating. So I don't know exactly what that means, but it never came off the market anyway. So I don't know.
Yes. So okay, so let's say, how can we tell if our kid is vaping? Because I think you're talking about how these companies are making them so that parents aren't aware, so that they can create these lifetime customers. So like, what are there behaviors that we can look at? Are there different things that we can notice to know that our kids are vaping? Or is it just about asking them? And then what do we do if we find one?
I think it's really important for parents to be aware of what these vape pens and these mods look like. And they could do that. I mean, even just go into a vape store and educate yourself on they are sleek looking. They are cool. They're really cool. Some of them are really cool looking. Like they're in the age of like the iPhone, right? They're sleek. They're small. They're, you know, some of them, like the mods, are a little bit bigger, but they're very well designed that you can put stickers on them. I mean, you can decorate just like a phone, or like the water bottles that the kids are doing that's so popular. They can do things like that. Knowing what to look for, I think, is really important. Unfortunately, some of them actually look like real pens and actually function as pens and highlighters. They actually have a dual function. There are some where I think you had mentioned, but they could vape from their sweatshirt, the drawstring, be a vape. Unfortunately, with these mods and with some of like with the smaller ones, the ones that aren't being able to be regulated, they they don't have as much vape. Some of these mods, you can get like an extreme amount of vape, an extreme amount of flavor. Like that's why they modify it. But I think it's really just knowing what to look for, educating yourself and speaking to the kids, if they do find something, like not like punishment doesn't work. It's just not going to work. Right. I mean, I think some kids would suppress it or hide it more because they're afraid to get in trouble. But if they are, like, personally, I think the best way to approach that is really with curiosity and with kindness and compassion. Like these kids, most of them, not all, not, I would always say most, many of them actually do want to quit. They just don't know how. So if you do catch or you see something, which, like I said, it's a little bit more difficult to actually find something. Although I find that with boys, it's a lot easier than to catch. Girls are a little better at hiding their stuff. But boys sometimes will fall asleep with it, or they'll keep it plugged in somewhere. And then the parents, even though it doesn't look like anything they might recognize, if they know what to recognize, they may be able to see it. So really with curiosity, like, what is it that you like about it? Like, what is it that you don't? Like, what do you wish you would have known before you started? Like, I personally think that, and this is something that I'm trying to work on, is getting groups of parents and kids that want to quit, like maybe friend groups that actually want to quit, and adults that are on board, and having a support for them, having accountability, having education, having open discussion to get these kids to really be able to quit and have the peer support. Because it seems like when kids are able to quit together, it makes it easier.
Oh,
Definitely.
yeah, totally.
Yeah.
Well, and I think that's how we've done things in the addiction world for other substances too, is like having support. I mean, that makes all the
Absolutely.
difference. Having
Right.
people know, having people understand, having people wanting to help us. And also, if we fail, being there to continue to support us.
Yeah. Yeah. I like what you said, because that's, I think, a big part of it. These kids want to quit, but they don't think anybody else does. And they don't think that they would be supported in that quitting. Right. Especially, I find that, so sometimes, like, I've been the intermediary between a child and a parent, where the kid doesn't want to tell their parent, but they'll come with me and I'll tell the parent. And I've never really had a bad experience with that. I've never had a bad experience. I mean, the parents want their kids to get help. And so that's just the first step, admitting that they have a problem, right? And then telling me, because I'm just telling them the facts. I'm not judging them at all, because I see it all the time and I get it. I've been a smoker. we all have our own addictions, right? We're human.
Yes.
But I think when you approach it that way and have parents, like, actually talk to their own kids about their own addictions, like what they wish they could change and what they wish they knew. And maybe we can help each other get through this, or we can make some kind of a community to help. That's my goal, to try to get that more into the school districts, or at least have the schools support it, because I think that's one of the best ways to get kids to quit, is to do it in groups,
Yeah,
with
I think that's great.
support.
Yeah, absolutely. So how do we talk to our kids about vaping? So like, we have lots of young kids, and I think, in my practice, when I think about anything that we have an opportunity to educate our kids around, the sooner we're talking about it, the better. But like, what else do we need to say around vaping? Like, what do you hear that kids wish they would have known? Or how can we talk to our kids about vaping and the dangers to maybe prevent them from doing it?
Prevention, I mean, obviously, I think, is the best. But unfortunately, when I see kids, they're usually not always. I mean, I speak to kids sometimes, and then, like, I have this kid. I love this kid. He doesn't live. I talked to him on Zoom. He doesn't live in my state, but he was going through a difficult time. He had some issues with bullying and through high school, and now that he was getting a little older, he was starting to get a little bit more self-confident when he got into his next year of school. And he actually talked to me about it. He's like, I really want to start vaping. Like, I just really want to start vaping, because he was starting to feel like he wanted to try to fit in a little bit, you know, and it's so understandable, right? Like I said, like, why wouldn't these kids want to? Like it appeals to so many of the things that they're looking for in adolescence.
Yeah.
They think short term, right? Short term, it may, but being able to educate him, and even my own kids, like I know, like my son would love to smoke pot, but he is not going to, because he knows that he's going to wait until he's older. Like, because we've had all these talks. He's seen me have these discussions with other kids. He's seen other kids suffer, you know, just through some of the things that I've told him. But some of my clients, it's like, I'll be able to talk them through that and get them to see that they are just setting themselves up for a major crash, you know, to become addicted to a substance like that, that is so addictive, you know.
Yeah.
They're going to lose their freedom. And that's what I emphasize. I like to try to emphasize, because I hear that from a lot of the older kids, is that they just want their freedom back. They're so sick of being a slave to this device. But that doesn't come right away. At first they love it, but that's going to eventually come, you know. I remember feeling, even though I love smoking, I remember feeling that way too. It's disgusting, right? It's dirty. It smells. Although vaping doesn't have any of those downfalls, right? It smells good. Sure. But bottom line is, short term, it may make them feel better because of all those advantages we talked about as a young person. But long term, they are just setting themselves up for a major crash. And it's sad. It's sad. But if I could stop somebody just because of the trust that they have built, just like a parent and child, or a client, and like I'm sure you have, it's awesome, you know, because it doesn't take much persuasion. Once they really trust you and they know what's going on, you give them a little bit of physiology around it, what's going on in their brain, why is it so much different for them than an adult. In an adult, it's a different story. You start after 25, you want to smoke pot after 25, or you want to do things after 25, you have a much less likely risk of getting addicted. But these young brains, right? And actually, I did a post on LinkedIn today about that, about how kids and teenagers learn so much faster than adults because their brains are just so primed, and they're looking for the next learning opportunity. And addiction is a type of learning. So they're going to grab onto that a lot faster. Those neural circuits are going to be developed and solidified faster, which is going to prime them for further addiction when they get older. And that's another thing that's, I think, really important for kids to know, you know, not so much parents, because that will scare them, even though they should know that, but they're going to use that as ammunition to kind of make that kid be like, whoa, like it's too much. Like they're like, stop yelling, you know, like I'm not stupid. These kids are not stupid. You know, they're not stupid. They're smart, but yeah. So just letting them know that they are setting themselves up for future failure with other addictions, and their brains are just primed. They, you know, the reward circuit in all of us for any substance, for anything, behavior, substance, it's all the same. So these circuits are being built in the same circuit. Like they're all being, these neuron connections are being built in that same reward pathway. We use the same reward pathway. And another thing which I forgot to say before talking about those circuits is the pleasure, the pain of physical pain and the pain of emotional pain are very close to each other in the brain. So that's why sometimes if you're having emotional pain, they say you could take a painkiller, like a Tylenol, Motrin, right? Because they're very similar places.
Yes. I read the articles on that, and that it does actually make you feel better.
Yeah.
But I also heard cussing helps you to feel better too.
Well, it helps me. I'm from New York, so it does help me feel better. And honestly, I use that, right? I mean, I'm from New York, so I used to curse a ton. I don't live there anymore. But I have friends sometimes when they come and visit and I start to curse again. But it could be, I don't know if you use this as a clinician, but I find that when you curse with your client, with your, like your teenagers, like they really, they can relate to that. And it builds a little bit of a bond. It works, you know, but it's also natural for me. So
Yeah, yeah, every once in a while. Yes, I certainly say what I think. But I think, when you were saying like coming at them, I think as a parent with the information of like, well, now you're just going to be addicted to things later in your life. I think we are afraid, right? So we're
Mhm.
trying to almost scare our kids out of doing something. And I don't find that that strategy works very well.
No.
I think it's more about educating, right? And staying calm and more like it's about like how you place those like nuggets of information where it's like, oh, I just read this really interesting thing. Did you know that the earlier you start vaping, the more likely that you will be addicted to other substances later in life or that you will have an addiction. I thought that was just really interesting. Right? Like, and you're not asking a question. You're just placing that out there. And I find that that is something that my clients work really well with, but even my own kids of like, I was thinking about this, or like I had this idea, or what do you know about this? Like educate me on this, like make them the expert. It's like the way that you do it is how you build that relationship and saying, being supportive because the reality is that we don't really have a lot of control over what our kids choose to do.
No.
And I know as a parent that that is something that is really hard to accept, but they're their own being. I mean, the reality is that when they were being created in your womb, if you were somebody who had this child in your belly, like they came out when they were ready, right?
Yes.
Like you did not get to choose, right? So like from the beginning and I remember in some of my pregnancies like it would be like the kid is like positioned in a place where their elbow is in my back or in my bladder or whatever and I'm like, "Oh my gosh," like trying to move them and sometimes they would refuse, right? Sometimes I could get them coerced to like move around and make me more comfortable, but like sometimes they're like, "Nope. Sorry, mom. Stay in this position." So it's like we didn't have control then. So to think that they aged and we somehow at 2 or 7 or 12 or 19 have any control over that, we just don't, which is okay. But it's about educating, right? Not controlling. It's about giving them the information and empowering them to make the decisions. Like, I trust you, like you can do
Yeah,
this.
that's so true. And that's how I raised my kids, honestly. When you said that, that totally reminded me because it works. And I did trust them. That's the thing. You have to set them up to win. You have to find them winning. You have to point out the things that they're doing that are good. And you can't fake that. You
Yeah.
have to trust your kids. And if you don't, you have to create scenarios where you're going to catch them being good. You're going to catch
Yeah.
them being honest, and then praise that. And then
Mhm.
praise yourself for being able to know how to do that, and that's, because the other way just doesn't work. And
No.
another thing that you said that really struck me, and I know a lot of my colleagues feel the same way, is a lot of our kids' fears these days, maybe always, I don't know, but comes from parent anxiety. I mean, a lot of it comes from parent anxiety. I don't want to say all, but I would say most of our kids' fears and anxiety is coming from parental anxiety, that whether consciously or subconsciously, we are transferring that to our kids. Um, and they're picking up on it, and then we don't know what to do with it, and then we get scared, and then the cycle continues. These kids are going to be okay. They're going to figure it out. Are they going to have bumps? Yeah, they're going to have bumps, sometimes major bumps. There's a saying in neurology that says keep them alive until they're 25, and I love that because it's true. Like, just keep your kids alive until they're 25, and then they're going to be fully functioning adults where their prefrontal cortex is online. They're going to be able to make some of these decisions more consciously. But one misperception that I wanted to maybe clear up for some people, I think, is that there's so much emphasis on the brain developing at 25 and becoming adults at around 25, which actually they're doing studies that it's actually taking longer because of all this helicopter parenting and kids are not able to make their own decisions.
Mhm.
But to know that at 20 or at 19, I mean, these kids are brilliant. I mean, my daughter's in a really good college in Chicago. I mean, she's surrounded by kids that are brilliant and they're not 25 yet, you know? but their brains are functioning and they're online. But what happens, and this is the part where people have that misperception, is that they can function fine, but when they get an extreme amount of stress, that's when things go awry still at 25, and for adults, right?
Sure.
So you can imagine that under 25, they're going to be at a disadvantage because they don't have all those connections in the prefrontal cortex. They don't have those executive functioning decisions and the those kinds of things 100% yet, but they're still functioning and they're still brilliant and they're still smart and they're still able to make decisions. But when they get thrown off, just like any of us, they're going to have that disconnect where they're going to be more impulsive. They're going to maybe make decisions that are not as they would if they were over 25.
Sure.
But it's not that they're, subpar at under 25.
Sure.
So I think that's an important thing for people to know, because they're still smart kids. They can still make decisions. They might not always make the best decisions, but none of us do, right?
Yeah.
So just supporting, educating, empathy, compassion with these kids, like curiosity, all these things work, So I don't know.
I love that, because I do think that sometimes we see a smart kid and they're young, and so then we treat them older, or we assume because our kids make bad choices that they're not capable of doing that. And so I think it's a lot of fear, right, on the parent side, right, of that, because we want our kids to succeed. We want them to live happy, healthy lives. We want them to have a better life than we had, or an easier time. And I find that the way to actually do that is actually supporting them, allowing them to like embrace fear, right? Like, this feels scary to go against the grain, but like, you can do it. I believe in you. Like, if that's something you want, you don't want to start vaping, even though everybody is. Like, I believe that you can't start if you don't want to. Like, you have a choice here, like empowering them to make decisions too.
Yeah. And sometimes preparing them, so like I said, my daughter is in school and a lot of people are smoking, vaping, drinking. She doesn't drink either, but she's managed to find people that are similar to her, that will come home with her earlier from a party. Once people start getting like obliterated, like she's done, like she wants to go home. So she's found people that will support her and go home with her. Or she found people that don't drink, not many, but she has found some friends. She just finished her first year, but she has found some friends that don't drink, or she found friends that will drink in moderation and then, go home. But with the vaping and the smoking, she's also a performer. She's a singer. So that's her excuse. Like, I can't vape because I don't want to screw up my voice and it hurts. It actually, So having kids find something that they can use as an excuse, they could pull out of their back pocket, like maybe make a list of 3 things that they can use if somebody asks them to do something that they don't feel comfortable doing. And that could be different for everyone. Like, it could be that they're, I don't want to screw up my sports. I don't want to, we have a history of asthma in our family. Whatever it is that gives them that. And so then people will say, okay, and she's never had any problem with it. She's never had any resistance from friends. Like, if you say no, then it's no. Most of the time. Now, for middle school and little younger kids, it might be a little bit more difficult, but having something in their back pocket to pull out to say, no, I can't do this because, but I'll hang out with you,
Yeah, totally. Yeah, it's not an all or nothing. I think sometimes we get such in that mentality of like, you can't be friends with somebody that, if they're not exactly the same as you. I do think being exposed more, right, would be a more challenging place to be, right? Like, it's harder to say no if they ask you several times on different days. But I do think, being conscious of that, like, we can still be friends and you can do your thing and I can do my thing and we're good. Yeah. So what do you want teens to know about this vaping? Like, what do you think is important for them to know, if you could speak directly to teens right now?
That if they are vaping and they want to quit, there are others around them, believe it or not, that actually want to quit too. And it's possible. And for parents and adults, for kids and and parents, that there is so much help out there to make this transition a bit easier. There's so much support out there that they could tap into if that's something that they really wanted. And if they haven't started vaping, or they haven't started, or they're considering, to know that in doing that, they're going to be giving up their freedom. And that's something that they may not understand without having lost it. But once you've lost it, you're not going to realize how much you want it back. And it's just not a fun place to be. And like you had described, like the pain that goes with actually wanting to quit is so not fun. And sometimes these kids will start and they'll say, oh, I'll quit when I'm in my 20s, or I'll quit when I'm in my 30s. But it just gets harder and harder because it becomes more and more of a habit, and it becomes more and more of an addiction, and your body is looking for it. It is calling for it. It's demanding it, right? It gets to first where it's calling, and then it's demanding. So just, again, they don't always have that impulse control, but it doesn't take much to get addicted. It's not like they have to be vaping every day for weeks, months, years. They can get addicted quite quickly. And that's when these kids they don't understand how this became such an intense obsession over just a couple of weeks, and then they're stuck. So just don't get yourself into that situation if you can. And if you are, then reach out, find somebody that could help you, because there's all sorts of people that would want to.
Yeah. So that what you were saying made me think of this quote that I read years ago that just really has stuck with me, of like, the healthy man or woman, person, right, wants everything. Like there's so many things that they want in life, but the sick man wants only health, right?
Yes.
So I think that part of like thinking about, like, you have your entire life ahead of you. You can do anything, like you can become anything. But often when we become addicted to something, the only thing we want to do, like the only thing we're thinking about, is to get out of the addiction or to get healthy or whatever. And so it's like, if you're not willing to give up those other things, right, to just have this one dream of being off of, substances, right, like vaping, then maybe you don't start. Maybe that is empowering to think like, no, I want tons of things. Like I don't want anything to get in the way of my dreams. And I'm not saying that people who vape can't have dreams. That's not it. It's just that the thing that gets in the way is it becomes the obsession. It's the thing that you want. It's really the thing you think about most. And if you don't have it, it's the thing you want to like fix that void, right? Versus thinking about all the other things that you want to do in life.
Yeah. Yeah. And like, just like you said, like it's that thing that's always on your mind because it's your body's going to be demanding it. So you can say, I'm going to go through the day, and do get all these things accomplished, and you could, but there's going to be multiple interruptions of craving, so people don't realize that. I mean, could you imagine, every 30 to 45 minutes, with a cigarette, it's not usually that bad, or they can sit and have a cigarette, have a few puffs. That's, again, those neural circuits, but it's not that often because the nicotine concentration is higher in many of these vapes. So it is just more addictive.
Yeah. So what do you want parents to take away from this conversation? We've had such a good conversation around this. And I know that, having a kid who is addicted is hard, but like we can also do this. But what things do you want parents to take away from this conversation?
Really just to educate themselves and to maybe understand why anger and punishment in this case is not going to generally work. Kids may hide it from you and keep it away from you because they're afraid of getting into trouble. Or maybe they even will delay because they're afraid of getting into trouble. But once they get into those adolescent years, I talk a lot about the normal or the typical adolescent brain. And then I also talk about the addicted adolescent brain, but there's a normal part of development. I think most parents know who have lived through it, that in adolescence, their brain is actually telling them to push away. And that's why they've even done studies where they actually tune their mother's voice out. It's a physiological thing because that's part of nature. It's part of the separation. It's part of healthy development, right? Yeah. We just have added some of these unhealthy things into our kids' lives, right? But that is a normal part of development, and the rebellion and the pushing away and needing to be with their friends. If you think about it in nature, this is with adolescents of different species too. If they're kicked out of the tribe, like a deer, or a wild horse, that's life and death. And it's the same for adolescents. If they are kicked out of their tribe, in their mind, this is life or death. So they are going to do whatever they can to keep those bonds stronger than keeping those with you. Mm-hmm. So it's part of you. It's part of the way our brains were developed and are developed. And understanding that may be a little easier to understand and have compassion for what these kids are going through. They're stuck. Like, right? They're stuck.
Mm-hmm. It's hard.
They're stuck.
Yeah. Well, thank you so much for this conversation today. We have so enjoyed having this and being part of the show. Thank you.
Yeah. It was great. I really enjoyed speaking to you. Thanks.
Thank you so much for joining us today. I don't know about you, but I really appreciated that conversation with Dr. Mandel. So thank you so much for that. I feel like I'm taking a lot away and just like thinking about how I can support the kids in my practice, but also the kids in my own family, of like preparing them, having these conversations ahead of time. So I hope that you took away some really important pieces as well. With that, I will say thank you so much for your time today. Please rate and subscribe to our show. Follow us on Facebook and Instagram and YouTube and TikTok, and keep the emails coming. Please continue to send us requests for episode topics to accidentalexperts@gmail.com. Have a fantastic day. Some words from our legal team.
The information presented in this podcast is not intended or implied to be a substitute for appropriate professional advice, diagnosis, or treatment. All content, including text, graphics, images, and information contained on or available through this podcast, is for general information purposes only. This podcast makes no representations and assumes no responsibility for the accuracy or information on or available through this podcast, and such information is subject to change without notice. You are encouraged to confirm any information obtained through this program with other sources and review all information regarding any condition or treatment with the appropriate professionals.
What we're saying is, yes, I am a real therapist, but I'm not your therapist.